Designed by Dr. James Cox, founder of Cox Technic, Flexion, Distraction, and Decompression, Cox seminars offer evidence-based application and support to chiropractic physicians who invite the tough cases, the disc herniation and stenosis cases, as enthusiastically as other more common spine pain cases. Cox seminars, workshops, and webinars are based on the evidence-based research gathered thus far and being attained by NIH and HRSA and other federally funded studies into the how and how well of Cox Technique treatment application to the cervical, lumbar, and thoracic spine. These outcomes have been presented at conferences like the ACC-RAC, International Society for the Study of the Lumbar Spine, the World Federation of Chiropractic, most recently in Africa in April of this year, the International Workshop on Virtual Rehabilitation, and several other scientific presentations. Research isn't done in a vacuum. It's done in cooperation with those inspired by interest in back pain and its relief. It's truly an interdisciplinary effort. Researchers from chiropractic medicine and research participate. They come from Palmer Research Center, National University of Health Sciences, Loyola Stritt School of Medicine at the Hines VA Hospital, the University of Iowa, University of Illinois, and many others. This leads to solid research outcomes. Research outcomes are well documented. It's found that flexion distraction is better for radiculopathy relief, better for chronic moderate severe low back pain, for chronic mild low back pain, recurrent mild low back pain, than medical conservative care. The fewer doctor visits were needed 1 year later by chiropractic flexion distraction patients. Intervertebral disc pressures dropped. The intervertebral foramen was increased by 28%. And patients are better for low back pain relief 1 year later. And at the seminars, the research is put into clinical terms and action. Clinical outcomes are shared via cases from actual doctor practices. Algorithms of decision making help you decide how you're going to treat a patient, whether it's Protocol 1 or Protocol 2. Hands-on protocols. You get instruction as well as hands-on practice time. And at seminars, continuing education credits are arranged via the National University of Health Sciences. Academics at Part 1 focus on non-discogenic conditions, while those at Part 2 focus on discogenic conditions. Hands-on practice at Part 1 is introductory, and at Part 2 is more intense and available, with an objective transducer to measure your pressure application. Academics and hands-on meld together at Part 3 courses, which share clinical application via case reports of actual patient cases interwoven with the latest in spine research as well as demonstration of treatment technique. And at workshops. Workshops are small, just 2 to 6 attendees. They're led by certified Cox Technique doctors. They're held in just 4 hours and in clinics of our certified doctors. They're held in many different locations, from Mayetta, New Jersey, all the way out to Wildomar, California. A few of them even have CE credits. Most convenient today, webinars allow you to study in short sessions and stay abreast of the latest in spinal pain research, neuroanatomy, biomechanics, examination, treatment, all from the comfort of your home or office. Join a live session to be the first to be excited by the presentation, or for those of you in different time zones with schedules that don't allow a live attendance, register for an on-demand recording of the presentation that includes the video and the printout of the slides presented. Any way you choose to study with Cox Technique, seminars, webinars, and workshops are readily available. Just go to www.coxtechnique.com, click on Doctors, click on Seminars for a current list of opportunities. We strive to offer the most effective chiropractic educational opportunities to support the chiropractic back pain specialists like you. Taking the Cox courses over this year has really revived my enthusiasm for the profession and the practice, and opened me up to the power of what we can do. Having the evidence and the protocol for back and neck pain has made a huge difference for me. Dr. Olding sums up what we try to do in all of our Cox seminars. We look forward to seeing you and supporting you in your patient care with chiropractic spinal manipulation and Cox Technique protocols.